We are going to get started. My name is JJ. I am with NCIMS. So if you have not already named yourself appropriately in your Zoom name, please do that if you can. And then please make sure that you're also on mute once we do get started. So welcome everyone. Hi. I see John Wilson. Hi, Dr. Wilson.
Hey, JJ.
Hello. It's great to see you here. Dr. Sadler, Dr. Montgomery. Dr. Montillis is on. I know she's in the car though, so she may not be able to rename herself. So if you see a phone number, that's her. Oh, Amanda, hi. Okay. Aaron Stefanacci. Noble Thomas. I see some of our board members. Okay, welcome everyone. Thanks for joining us. So tonight's webinar is sponsored by one of our year-round partners, Senesco International, and we are so glad that we have with us this evening Dr. Sharon Norling. You all know from the invitation that the topic tonight is neuroendocrine balancing. So we're super excited that we have somebody that actually has that area of expertise. Dr. Norling is a nationally known and highly respected medical doctor. She specializes in integrative medicine and practices advanced functional medicine. She is a graduate of Case Western Reserve School of Medicine and has trained at USC and UCLA. She's also board certified in OBGYN, integrative medicine, and medical acupuncture, which I've never had a chance to ask her about, so I will have to do that soon. Her specialties are hormone and neurotransmitter balancing. She's also the author of a few textbooks, and she has a book of her own that she wrote. I think it's something about your doctor. What's the name of that, Sharon? Your doctor is not telling the truth. I think it's something like that. Let me see if your doctor is wrong. That's what it is. And the textbook is Integrative Functional Medical Nutrition Therapy, published in 2020, among other books. So welcome, Dr. Norling. Thank you so much for joining us this evening. And we'll need to unmute her one moment. Dr. Norling, if you can hear me, please try to unmute.
Thank you so much for this opportunity to speak. And I just wanted to mention about my book, Your Doctor's Wrong. And I wrote it as a voice of my patients who had either been dismissed, misdiagnosed, or just written a prescription for a pharmaceutical drug. And it is their voice that I wrote that book for. And you know, as physicians, healthcare providers, we've all been wrong at some point or another. But it is kind of a good read, I have to say. But, okay, so today we're going to talk about mood disorders and mood-related complaints. And I submit to you that everyone on this webinar has had some mood changes at one time or another, and we know that our patients do, and particularly during these unprecedented times. So I'm going to talk about what can we do for these patients. First of all, we can test neurotransmitters. And many times my colleagues will say, you know, you really can't test for neurotransmitters. But Neurolab is excellent as a neurotransmitter lab. And I've actually used them for 16 years. And I've also used their targeted nutrient therapies for the same number of years. So it's really important to be able to test the patient so that we're treating that patient as an individual based on their symptoms and their labs. Because I think treating the average is way overrated. I think one size fits all really doesn't work. The other good thing about Senesco is that they have research to back up the effectiveness of this model of testing and treating with targeted nutrient therapies. And tonight, we're also going to do a case study. Actually, it happens to be one of my patients, and one of those that we all can kind of relate to at different times. I would call her kind of challenging in the past. But we do know that stress is on the rise. And when you see the World Health Report of 6% with mood complaints, I think the 94% they're not testing. I think 33% that are shown in research at primary care physicians in their practices. What I found, and first I thought it was because I was living in California, and I was testing everyone, and I still do test every patient. And I was finding like 95% of them had some stress, whether it was financial or it was relationship or it was a spouse or not having a spouse or it was their children or it was their work environment. Something was causing them stress. And we do know that since the pandemic, that the stress numbers have quadrupled. So the common symptoms that we see, of course, is anxiousness, low mood, difficulty sleeping, headaches. Those tend to be really, common, as well as lack of motivation or apathy and lack of focus. In the past, you used to be able to multitask. Now it's just start a whole bunch of different projects and none of them are really very complete. So what are some of the moods that we see in our patient population? And in functional medicine or integrative medicine, often we see patients that are complex, complicated, and who've been to many doctors before. And it is a gift that we have tools to be able to test the patients and treat them with personalized medicine. So we have patients who have a low mood and they're agitated. We have patients who have a low mood and they're lethargic. So it isn't clear cut. There's a wide range of symptoms. They can have some obsessions, or they can be apathetic or irritable. Maybe they're angry. Women will sometimes experience PMS or menopause. And we know, and we're going to talk about andropause too, because we don't want to let the men, we don't want to ignore the men and being able to support them as well. But this is complex. It's multifactorial. So when someone has a mood disorder, it could be from sleep, it could be from not exercising, it could be poor diet or a lot of sugar in their diets, or toxins, or even genetic factors. And there's a variety of stressors, which I've mentioned some of those. It could be an immune response, but often it's related to hormones, the sex hormones, because the neuroendocrine system works. The neurotransmitters work with the thyroid, work with the adrenal function, work with the sex hormones. So for example, if you have a patient who's lacking clarity and they're tired and you diagnose hypothyroidism and you only treat the thyroid, that's like sitting on a one-legged stool. So looking at a wide range of different symptoms and how they might relate to different organs. This is kind of an overview of a path to optimal wellness. And really what that boils down to is balancing the inhibitory neurotransmitters, the calming, happy neurotransmitters. It's about balancing the excitatory or the catecholamines so that they're in balance in that category, but also in balance with the inhibitories. Because when those neurotransmitters are out of balance, that's when we really begin to see the manifestations of mood disorders. So what does the literature show? Well, again, this is a summary of categories: excitatory neurotransmitters, inhibitory neurotransmitters, hormones. But also we have to be aware of the impact of inflammation. So sometimes we're testing the cytokines, or it could be genetic and there's a single nucleotide polymorphism, a SNP, that might be impacting someone's mood. Or it could be toxins, and the toxins especially affecting the brain and neurotransmitters, norepinephrine in particular. And as I mentioned earlier, there's different combinations of the neuroendocrine imbalances. So people could have a low mood and be lethargic, or a low mood and be agitated. They could be apathetic all the way over to obsessive. They could be irritable or angry. So it's not a simple A, B, or C. It's a combination many times of the manifestations of these imbalances. So let's just look at low mood with agitation. We know when serotonin is low, people feel anxiousness. They have 70% have difficulty sleeping. About 70% will hurt more, and they might have a low mood. They might crave carbohydrates or have some obsessions, in their daily activity. So I've seen my colleagues, if a patient is having those symptoms, just prescribe an SSRI. Well, maybe the anxiety is due to low serotonin, but maybe it's due to low GABA. Maybe it's due to high levels of norepinephrine. Maybe it's due to high levels of cortisol, the stress hormone. So the testing is key. And I test every patient, as I mentioned. You can see the pathways on the right, the tryptophan going to 5-HTP to serotonin to melatonin. I'm going to just mention that sometimes we'll see an elevated serotonin. Most of the time, that's with multiple mood-altering pharmaceutical drugs. Occasionally, a patient will come to me with high levels of serotonin, and maybe he or she has been supplementing, self-medicating with 5-HTP or another product. So being able to test, and one of the questions I always have from patients is, do I need to get off of my mood-altering pharmaceutical drugs? And I always test them while they're on it, because they've come to me. They might come with arthritis, they might come with gastritis or GI symptoms. But when I talk to them, they almost always have some stressors in their lives and some moods that are changing. So being able to test and figure this out is really key. Low mood with agitation. Now, this is the section that we're talking about is really involve the excitatory neurotransmitters, like the catecholamines. So when norepinephrine is elevated, people have low moods, but they're experiencing anxiousness. And when norepinephrine is elevated, people get angry too, and their blood pressure can be increased. So some of this might be coming from increased sympathetic nervous system activity, and also when the HPA is elevated. But it's one of the key neurotransmitters to be tested. Glutamate. When glutamate is elevated, it really can become neurotoxic. And then this excitatory toxic level of glutamate can also lead to inflammation, which in itself is linked to mood disorders. And particularly inflammation that's been tested, the cytokines have been tested, those patients are often experiencing a low mood. Now, this is low mood with agitation, and we're going to look at the hormones. In particular, we're going to look at cortisol. So the corticotropin releasing factor will be increased when the patient's moods are low. So that stimulates the adrenal gland to make more cortisol. And when the cortisol is too high, people are experiencing more anxiousness. So that is a regulator of the system. We also have patients who come to us and they'll say, my thyroid is off. My thyroid is just shot. I know it's my thyroid. It may be the thyroid. Many times when patients are coming to us with a complaint saying, I think it's my thyroid, they're often coming because they're experiencing hair loss, or they might be fatigued, they might have mental clarity that isn't, or lack of mental clarity. They might have difficulty with weight gain. There's a wide range of things. But we also have to be cognizant of the fact that it really can change our moods as well. Now, we can have low moods with lethargy. And when dopamine is low, there certainly is a low mood. People are tired. Dopamine is that feel-good neurotransmitter, the one with joy and euphoria, and you've got a bounce in your step, and you're motivated, and you can focus really well, and your libido is up. So when dopamine is low, the opposite is occurring for that particular individual. Also norepinephrine, similar, with the low moods. Cortisol levels are often decreased when there's low moods, and then there's, lethargy as well. And there's adrenal fatigue. Patients are tired. They might crave salt. They have more inflammation. When people have adrenal fatigue, they wake up in the morning and they're tired. They can barely get out of bed. Even if they've slept 8, 9, 10 hours, they're still slow to get out of bed, and then they might get a little more energy. They might get daytime sleepiness, and then they might get a second wind at night. That's kind of classic for adrenal fatigue. And a low thyroid can also be impacting and contributing to the lethargy. So this is kind of a summary. If we look at low mood and agitation, or we look at low mood and lethargy, so those are in categories. But if the patient has both of those, then it's really important to look at the red blood cell count, look at serum ferritin, check the omega-3s, and also look for increased inflammatory cytokines. Patients might also have low DHEA, and DHEA is very important to support the adrenal glands. Now, anger can present itself in a wide range of expressions. It can be impulsiveness or aggression, hostility, irritability, violence, any one of those things. So when we're dealing with either an angry patient or anyone that's coming to us, or their spouses are coming to us, what can we do to decrease that anger? Certainly looking at their lifestyle and some of their relationships. But it may be low serotonin, and it might be because the serotonin signaling has been impaired. We also know that increasing serotonin will reduce aggressive behaviors. The anger can be increased by dopamine if it gets too high, and especially with drugs that people might be using. That can really be an issue. We know that dopamine and serotonin have inverse effects. So while the dopamine will raise the aggression, the serotonin will decrease it. Glutamate also, in studies in rats, has shown that they increase their aggression if the glutamate is too high. And I also wanted to mention that on this slide presentation, on this slide deck, that you will see numerous references. There's 102 references documenting this talk, and they're all listed at the end of this presentation. Also, the slides will all be available to you, this slide deck, on Senesco's webinar. and Senesco's website. Anger and hormones. Androgens are really important for men and for women. Testosterone is a female hormone. It's made by the ovaries when they're working, and it's made by the adrenal glands. So that's an important component. And the importance of testing males for testosterone cannot be overemphasized. We know that men in their 40s start to decrease the amount of available testosterone in their bodies. Estrogen, although the studies show that it could either increase or decrease aggression, most of the literature and my decades of experience in counseling women and estrogen replacement therapy, I believe that most of the time it decreases aggression because it's a partnership with estrogen and serotonin. And I'll talk more about that when we talk about PMS. But let's look again and see what the research shows, that if the dopamine, serotonin, and glutamate are impacting obsessive behaviors, about 78% of the time, their levels are low or low normal. It can also have an effect if people have had psychological and neurological traumas. We'll see that the genetic expression can be modified and can also trigger some symptoms. So it's really important to balance or mitigate obsessive behaviors by balancing dopamine, serotonin, and glutamate. Sometimes, as I mentioned, there can be apathy, and which neurotransmitters are important with apathy. And certainly it's a common sort of symptoms that we see now, I think, with the pandemic as well. People have sometimes lost some interest, their ambition, their drive, and things are just very different in these unprecedented times. But when dopamine or norepinephrine are low, this is exactly what we also see, because norepinephrine actually impacts alertness, and low levels can contribute to apathy. Again, you'll see this catecholamine pathway on the right of this slide, and you'll see that the rate limiting factor is the tyrosine hydroxylase. Now, catecholamines, if they're difficult to correct the balancing, it may be due to a toxin, some heavy metal or environmental toxin, and that can be triggering inflammation, which again decreases the expression of tyrosine hydroxylase. Apathy, hormones. Thyroid, when it's low, there's discouragement and apathy, and lethargy. And I want to say something about testosterone too, and we'll be talking a little bit more about that. But testosterone actually increases tyrosine hydroxylase, and it actually helps dopamine levels and the transport activity, and it improves the excitatory, the catecholamine neurotransmitters. So again, as I mentioned, the hormones work with the adrenal glands, work with the neurotransmitters, work with the thyroid. And again, if you're only checking one endocrine system, it's like sitting on a one-legged stool. This is obviously a slide on PMS. And we had some misconceptions about PMS, which I'll be able to help clarify for you. But people who experience PMS, they can be anxious or have anxiousness and low mood and carbohydrate and chocolate cravings and mood swings and difficulty with insomnia, poor concentration and changes in libido. And these symptoms actually are very commonly seen in low testosterone. PMS, we used to think was because the estrogen declined more at the second half of the menstrual cycle. And while that is true, if the serotonin levels are normal in that premenopausal woman, the PMS symptoms will not generally appear, even though the estrogen is lowering. Because in the first 2 weeks of the cycle, the estrogen is actually at a normal level or an optimal level, and it's covering up the symptoms of low serotonin. And during the second half, it's lower and not able to cover up those symptoms. So the key in PMS is actually balancing the serotonin. Also with menopause, we know that 70% of women with menopausal symptoms have low serotonin levels. And estrogen, again, I talked about the relationship between estrogen and serotonin. But the estrogen actually promotes tyrosine hydroxylase expression and actually supports serotonin activity and inhibits serotonin reuptake. So it often is seen with improving moods. Now, there's a lot of questions, particularly in the past, about using estrogen for women. And we know that women who are balanced throughout the menopause, so they have balanced estrogen, progesterone, and testosterone, as well as thyroid and adrenal. We know that those women decrease the risk of Alzheimer's by 50%, decreases osteoporosis by 37%, decreases hip fractures by 50%, decreases colon cancer by 30%. We also know that several papers have come out, including a study done by the Mayo Clinic, 52,000 women, and their conclusion was use of estrogen and or progesterone did not contribute to an increased risk of any type of cancers, strokes, or heart attacks. So I think we're becoming more educated on the benefits of using hormone replacement therapy, particularly bioidentical. But again, it's always the woman's choice. It's important that they have all the information to make the best choice for themselves. This is kind of a summary too of low progesterone in menopause can lead to low GABA because they're partners as well. And the low testosterone, low thyroid is also seen in menopausal women. So again, it's about testing these. We're going to spend a few minutes on andropause to give our male gender their opportunity for learning as well. Andropause. We know that testosterone increases the tyrosine hydroxylase, supports dopamine, supports the catecholamines. But it's really important that men get their testosterone levels checked. If it is low, it triples the increased risk for developing Alzheimer's. It not only contributes to moods and muscle wasting. We hear about it with erectile dysfunction and low libido, but it also can impact the development of chronic illnesses. So it's an important key. So the men need to be balanced in their hormones. They're given the opportunity to do that. We know that testosterone actually stimulates serotonin transporter. So it really is an integral part. When we talk about balancing, yes, we need to balance neurotransmitters, thyroid, adrenals, and sex hormones. And Senesco's NeuroLab tests neurotransmitters, adrenals, and sex hormones. So let's look at the system. How do we get this done? How do we help our patients? How do we help ourselves? And I recommend that every healthcare provider do this neurolab and use the targeted nutrient therapies if indicated. Because once that happens, they really begin to understand the process and realize how beneficial it can be to their patients. So first of all, there's a small kit that actually can be shipped directly from Senesco to your patient. We happen to also carry it in our office, so patients can just pick it up there. In the kit, it will have the collection for the urine and saliva and a form to fill out what the patient symptoms are by that patient. Then, when the lab reports are back, you get the lab values, and Senesco has taken the lab values and correlated it with the patient's symptoms and written up a correlation analysis that is thorough and comprehensive in that report. It's very good educational materials showing the relationship, and I give it to all my patients as well. And the recommendations for the targeted nutrient therapies are also recommended. So first, test the patient, then treat as indicated, and then retest about 8 weeks later, just like we would with thyroid. Someone has low thyroid, we treat them with thyroid, we retest to make sure they're getting in balance. Make any adjustments that may need to be made, and then probably about 3 to 6 months later, I will retest another time, or sooner as indicated. Now, I mentioned that Senesco's done a study, 20,000 patients, and found this study to be statistically significant in using the NeuroLab and the targeted nutrient therapies. You can see the green bar graphs. Those are the symptoms on a scale of 0 to 4 of the patients that were in this study. After they were tested and treated, you can see the dramatic change in the outcome. Lifestyle factors, of course, need to be mentioned. We're all aware of them, but making sure that the patient has enough B vitamins as their cofactors in many of the pathways, as well as fish oil, multivitamin, making sure vitamin D levels are normal, and encouraging exercise. So we're going to talk about 3 of Senesco's targeted nutrient therapies. Now, what's impressive is that all the targeted nutrient therapies actually are created at a GCMP facility for quality. They are free of gluten. They're non-GMO. They are free of hydrogenated oils or partially hydrogenated oils. They are free of allergens like peanuts and nut trees and soy and wheat, as well as yeast and shellfish and fish, eggs, or artificial flavors or preservatives or sugars. So it is really formulated with the highest quality branded ingredients, and that's important. People will often go over the counter or online, pick some random supplementation of 5-HTP. And the quality control on those is often lacking. And studies have shown that many times 40 to 50% of the ingredients in there are too low, or there may be toxins in those. So Senesco has been very careful about presenting the best quality in their targeted nutrient therapies. Most of their supplements also have a neurosupport blend. So they have some digestive enzymes in there. Then they have biopurine. Biopurine is great because it enhances the GI uptake of these nutrients. And it does so by increasing the blood supply to the GI tract. It also emulsifies the contents of what's in the GI tract. And then it actively transports the nutrients across the gut wall into the bloodstream. So again, very, very effective. I'll go over these a little bit quickly, but all this information is on the website, and you'll get copies if you want them of this particular webinar. So Prolent is generally used to help to support low serotonin, and it has inhibitory neurotransmitters, it has vitamins, and it has that neural support blend in it. And this is how it works. The rate limiting step is actually the tryptophan hydroxylate. So you can see as that goes into 5-HTP and eventually on to serotonin. And it works because it has glycine in there. And glycine is one of the primary inhibitory neurotransmitters in the central nervous system. And it has xanthionine. Xanthionine antagonizes and can block the glutamate receptors. So glutamate can be very excitatory and create aggression and anxiousness. So it is really supporting the serotonin by helping it to become what it's supposed to be, a calming, happy neurotransmitter. Generally, and again, specific recommendations will be given in the lab depending on the individual. So generally, it's Prolent 1 at night, and after 5 days, taking 2 at night. It might say evening or PM on it, but it really is in the evening. And it's very relaxing. If the patient gets a little more energy and they want to take it during the day, that's fine too. Contegra supports norepinephrine, epinephrine, and the ratios. It has great methylation properties to it. It has methylcobalamin, 5-methyl tetrahydrofolate in it, and it's unique because it is broad spectrum for the wired and the tired, but it helps the catecholamines, it helps the inhibitories, it has some thyroid and adrenal support in there. We've talked about the wired and tired. We know that we have products to correct those. And Contegra, again, just looking at GABA, it helps to release GABA. And when GABA is low, people are anxious. They don't sleep very well. They're also hyperactive. So sometimes you'll see a man, and I've seen men. Well, I don't go out looking for men. I just want to let you know that. But I've seen men where their legs are bouncing up and down. And I'll think, oh my gosh, he's got low GABA. And then I think, Norling, you got to get a life. You can't be out in public diagnosing men with low GABA in your head. So they also, this group with low GABA, they tend to worry more than the national average. So Contegra supports the adrenal glands as well as the thyroid. It works to convert the process of norepinephrine going to epinephrine, which is very, very important. When people have low epinephrine, they're tired. They have difficulty focusing. They have some blood sugar dysregulation sometimes and might have difficulty losing weight. So using Contegra, again, first we calm the patient down by supporting the inhibitory neurotransmitters, and then after about 10 days to 2 weeks, we would add the support for the catecholamines, and that is usually 1 in the morning. Adaptocin, great product for balancing the cortisol levels. So adaptocin, and we know that people who have adrenal fatigue really have a lot of fatigue, but they also have a lot of other issues going on with them because the adrenal support is so important for all kinds of metabolism. Now, there's several adaptogens in there and vitamins and minerals to support the adrenal function. And again, the Neurolab, Senesco's Neurolab, tests neurotransmitters, adrenal function, and sex hormones. So in the morning, obviously, this patient looks like she is way off the scale of the green bar that is showing the normal levels of cortisol. And it looks like she's low in the morning, afternoon, and throughout the day. I have a case study, and this case study actually happens to be a patient of mine, a 66-year-old patient. And I'll share with you, because I think we've all had these patients who can present and be rather challenging. And I assure you that this testing and this treatment was not only a gift to the patient, but a gift to me to have her imbalance. But she had some jaw surgery in 1993. Her last period was about 6.5 years before she came to me. And she would have 1 drink of alcohol a week and 1 cup of coffee a day. But she already had Hashimoto's thyroiditis, osteoporosis. She had Ehlers-Danlos hyperactivity, anxiousness, low mood, and sleep difficulties. And every patient who has a chronic illness also should be tested, because that is a stressor in itself. And she was on some hormone replacement therapy and thyroid medication. So this is her first test results. And you can see, look at the serotonin's 43, and optimal should be 125 up to 260. Her GABA was really low at 296. It should be 600 to 1100. Dopamine was low. Norepinephrine was normal, but her epinephrine and glutamate all low. And then she had low cortisol levels in the morning and low DHEA. So the therapy that I put her on was Prolent, like I mentioned, 1 at night, and then after 5 days, increasing it to 2 at night. The Lentra supports GABA, and because her GABA was so low, I actually had her start on 3 of the Lentra. And after about 2 to 3 days, I had her start on the Adaptocin at 2 in the morning. And then the catecholamine support came about 2 weeks later. And that again was Prosite D in the morning. And then she was on a multivitamin and fish oil and B complex. And this is her repeat test. And look at the significant difference. The serotonin is now normal. The GABA has gone up significantly and almost to normal. The dopamine, and this is, I wanted to comment on this, because you can see the dopamine went down a little bit, which is not uncommon when the inhibitory neurotransmitters go up so significantly, and then it will self-adjust. But the norepinephrine is normal. The epinephrine really improved and glutamate improved. She has a little bit elevation in her PEA, but the normal range goes up to 7.3. So she's adjusting some of her food intake and not having as much Chinese food with MSG in it. And her adrenal glands are balanced. She said she felt better than she'd ever felt before in her life. So I'm still going to retest her probably in another 8 weeks, but her moods are significantly better. Here is a list of the references. Like I mentioned, there's 102 of them. They will be on the website in this slide deck. Senesco has done a series of webinars this year, from sleep to anxiousness to cognitive function. And you can access all of those on the Senesco website. So I highly recommend that you start using the Neurolab and using the targeted nutrient therapies. You can treat that patient as an individual. And I really think it's so important for people, men and women, to be treated as individuals. As I mentioned, one size fits all doesn't really work. It also helps to enhance your practice. It helps to support your patients. And then it actually enhances your reputation for someone who has the tools, the solutions, and the actual expertise in providing the patients with a evidence-based, effective therapy to mitigate their mood changes. And you stay up to date. There's educational opportunities to continue to learn. And when you're just starting out using it, or even if you've used the Neuro Lab for many years and you think, oh, I'm really good at this now. I can figure out things that I need to do and change. And then you'll get a really complicated case. And so I just want you to know, under any circumstances, if you have questions, you just call Senesco customer service, and they will connect you with an appointment for the clinical support team. And the clinical support team will have valuable information, and they will talk you through and answer your questions. You can really grow your practice because people are looking for something other than mood-altering pharmaceutical drugs. They may have tried those before. Maybe they had side effects or difficulty getting off of them, or they felt like they couldn't stop them, but yet they still were having the symptoms. They're looking for options, and you have a great option to offer them. And it also improves your bottom line. So you can mark up the test kits and you can mark up the targeted nutrient therapies. So it's a win-win. And I also recommend that every one of you on the webinar also have this test done for you, for yourselves, or your family, or your friends, or your neighbors, or the people you work with, because you really want to be happy, healthy, and productive. And you want everyone around you to also be that way. Thank you so much. I've really appreciated doing this webinar.
Thank you, Dr. Norling.
You're welcome.
I'll be moderating some questions. So if whatever questions you all have, I do see a few already in the chat. Please go ahead and put them in the chat. The first question is actually, the first one that I see anyway, is how can we order a test kit for ourselves? So if we wanted to take you up on that.
Yes, so just call Senesco, talk to customer service, explain that you would like to do a test kit, and either Hamilton or Sarah in customer service will help you with that.
Okay, thank you, great. Yeah, I think that would be awesome to be able to get that test done. And I can think of other folks that might feel the same way.
Yes.
Let's see, one of the other questions is, if you see high serotonin, do you worry about serotonin syndrome?
Well, it's always a consideration. It's always, you know, we could find serotonin described in the literature. I have never seen a case of serotonin syndrome. And like I say, I've been using the Neuro Lab and the targeted nutrient therapies, seeing patients for too many years, too many decades to even admit to. And I've never seen it. Any colleagues that I've talked to have never seen it. I've had patients come to me and had really high elevations of serotonin because they'd been on some SSRIs or multiple ones. And none of them developed serotonin syndrome. And so I think it's rare, but I think we have to be aware of it.
Okay. Another question is, when is DHEA not appropriate?
Well, I think it really depends on the patient and any other conditions that they may have PCOS or obviously pregnant women. We don't recommend, some supplements too. And as an OBGYN, we really don't recommend anything other than vitamins. So it's very individualized, but I would certainly get a good history in the patient. And if there's any questions about whether or not you should also support the DHEA, if it's low, you can call Senesco and talk to the clinical team and then present that individual's case.
Okay, thank you. Let's see. Got a couple of other questions coming in. For very complicated cases, do you find doing a OAT or Dutch test helpful by giving you additional clues to the puzzle?
I
Or
haven't,
Dutch test.
yeah. So I'm not as familiar with that test, and I haven't used it in my patients. So I really don't have a comment on that.
Okay. Let's see. Okay, and then there's another question about how long do patients need to take the supplements?
That's a very good question too. It really, first of all, my patients will ask me. So it depends on where their levels were when we started this process, and also where they are in their life. Because once we get them balanced, if they are financially secure and they just adore their spouse, their kids are perfect, they love their job, and they have no stress in their life, we can taper those off and they do well. For many people, that isn't the case. So if you're going through a divorce and you've lost your job and, 3 people in your family had COVID, those people will need longer support to just help them be in their best neurotransmitter balance while they deal with their stressors.
Okay, thank you. Do we have any other folks that want to jump on the Q&A here? Yes, okay, Dr. Wilson, you're on mute. Let me.
Okay.
Go ahead.
What is your experience in using Clomiphene for men?
I'm not familiar with that use. So have you used it?
Clomiphene stimulates the production of luteinizing hormone, which will jumpstart the testosterone production and preserve the hypothalamic pituitary gonadal axis. So as to get less testicular atrophy than taking testosterone directly.
And have you found that to be effective in raising the testosterone to what would be considered a normal range? I know the ranges vary, but depending on what you read, it could be 800 to 1200 a level.
Well,
so
I find in some men it is helpful. And the reference range for testosterone and national reference labs is like 250 to 1100. So I think, and that's the range from age 18 to 70. I called the director of the Quest Labs and told him that I had the advantage of having been 18 and also having been 70. And I can testify that there's quite a difference between the testosterone experience between those two ages.
Yes, and I trained with Dr. Morgan Taylor. He's professor of urology at Harvard. And I actually use, when I'm doing my own PowerPoints, his slides from his presentations. But he has a book that he's published, for the lay individuals, and it's called Testosterone for Life. And in his studies, and he spent 40 years, that was his life's work, he found that if the ranges were actually low, like, below like 700, if they were in the 2, 3, 4, 5, hundreds, that it increased the risk for cancer and heart disease and diabetes and a wide range of chronic illnesses in addition to the other symptoms that we're more commonly aware of. So I think there's more information out now on testosterone than there was before, and even more information on testosterone in women, because they haven't been studied as vigorously as the men have.
Well, you may recall the astronaut John Glenn, who was quoted as saying that every man is proportioned to a certain amount of testosterone, and some choose to grow hair with theirs.
Yes.
One of the criticisms that I've heard of measuring urinary neurotransmitters is that you're not measuring what's in the brain, you're measuring the global concentration of the neurotransmitters. And what comment would you have for those with that criticism?
Well, and there's a good white paper out too that SNESCO has that you can request. And Dr. Chip Watkins did a lot of research on that. A couple things. One is we know we're pretty much knowledgeable about leaky gut, and we also know that intestinal permeability is what the term is often used now. But we also know that there's a leaky brain, and so more is passed over that blood-brain barrier than we ever thought of before. But I can tell you, in testing your neurotransmitters, urinary neurotransmitters, we've done that for about 60 years. When we were testing norepinephrine to diagnose a pheochromocytoma, the kidney. So it's not like a new event, but we also know that when these patients are tested, and the study, confirmed that, we see the levels, whether it's metabolites or levels in the bloodstream, that when we treat those patients with targeted nutrient therapies, we can repeat the test. So it's a great clinical tool, and we can see the levels increase. We also see the improvements in the patient's feelings and productivity, and their calm, and so we can see it from a wide range of things. And also the GI tract is so important in neurotransmitter balancing, because in GI tract makes 30 different neurotransmitters, and through the vagus nerve tells the brain what to do about 95% of the time. So it's complex, I think, and I think there's things that we don't really know for sure about.
We have another question. Is there a value in looking at transmitter metabolites in urine, and does it reflect brain and gut?
Okay, so that's kind of the same question that Dr. Wilson was asking. And Dr. Wilson, thank you so much for those contributions. So yes, again, it's a clinical tool. And if you want more information on it, there's a white paper that you can get from SNESCO that will give you research material, references, and other documentation. But we do know it as a clinical tool that we test, it's low, we treat, it responds, and the patient feels better.
Have you looked at any correlation between neurotransmitters and susceptibility to COVID?
No, I haven't personally, but we do know that neurotransmitter imbalances has a huge effect on cardiovascular, strokes, heart attacks, recovery. And I was a speaker for the Boston Heart Lab for years. And so that's a field that's well documented, and I'm sure other fields are too. So yes, it affects, because we have neurotransmitters, really receptor sites on every cell in our body. So it has to have a big impact on the health of an individual in a wide range of areas.
Hi, this is Melissa from Senesco. And actually, I can add something to the COVID conversation there. We're actually working on a white paper right now about the mental health pandemic and relations with COVID as well in there. And we've actually have some research in there that they're seeing in relationship to COVID. So we're hoping that that will be finished. I just reviewed the first draft today, actually. So we're hoping that'll be ready here in the next couple weeks. So that is something that we can make a note to share with you as well. So I just wanted to bring that in.
Yes,
That'd be great. Okay, folks. Well, I think we're going to go ahead and wrap things up. Thank you all for joining us today. Dr. Norling, thank you so very much for coming and doing this webinar and sharing your expertise in this area. We really appreciate it. And thank you again to Senesco for sponsoring tonight's session.
Yeah, thank you everyone for attending tonight. And thank you, Dr. Norling, for sharing your experience with us. I want to make sure, as we said, we'll share the slides with you on Monday. I'll send out an email to all of you with that. We'll include the validity paper. And I wanted to mention too, someone asked about getting a test for themselves. We do offer a discount for healthcare providers to test themselves. When you call Senesco and you talk to customer service, make sure you tell them that you're looking for the kit with the healthcare provider discount. Otherwise, they won't know to include the proper paperwork for you on that. And two, Dr. Norling mentioned the other webinars that we've had this year, all about mental health issues, since it has become, more prominent over the years, and especially over the last 2 years here. I believe it's been that long. So yeah, if you have, we can share that with you as well. If you have any interest in that, you can reply to the email or ask our customer service. And thank you again, everyone.
Thank you. Thank you for the opportunity.
All right. Thank you. Bye, folks.